Hi guys, welcome back to RT Share T, where respiratory therapists live out loud. With me, your host, Linda Fry, the asthma lady. Yes, welcome everybody. Welcome to anyone new and happy new year. Yes, we all made it to 2024, which is a true blessing. Because as we all know, there's a lot of people that did not make it. And we just have to start this year with just the positivity and just nice and fresh. All right, guys. So today's episode, we are talking about sharing inhalers amongst family members, right? And just sharing some tips on how to do that safely. But before we go into the episode, I just want to let everyone know, for those of you that are on the medication Flovent, which comes as an inhaler and a discus, an FHA and a discus, as of January 1st, 2024, Flovent has been discontinued. So for those of you that are on an inhaled corticosteroids, those with persistent asthma, please make sure that you go back to your provider to get a substitute or an alternative for Flovent. All right. So if you can't physically go to the doctor, then go for a televisit just to make sure you are covered. All right, guys. So we want to make sure that everybody got the memo. Okay. All right. So now going back to the episode of sharing inhalers within the family. All right. First and foremost, it is not appropriate for anyone to share inhalers with anyone else. Everyone should have their own inhaler. But we do understand within some families where it is necessary to share inhalers because of cost. Okay? Inhalers may be expensive for some families. So we do understand when folks go to this practice. All right. So today's episode, we're just going to share some tips on how to share inhalers safely. Okay. So number one, everyone should have their own spacer. Okay. So a spacer is something that makes breathing in the medication and getting to your lungs efficiently. All right. So it makes sure that it gets where it needs to be. It cuts down coordination and it just really makes sure that you get all the medication in. Okay. So that's what a spacer is. And you can get one from your insurance. Most insurance cover at least one a year. Or you could go to Amazon and get one for under 20 bucks. All right. So when it comes to sharing, you can share the inhaler, but make sure everyone has their own spacer. And this really helps with, once again, safety. Okay. So yes, so that's tip number one. Number two, you want to make sure that you are communicating well to all the family members the location of where the inhaler is. Okay, for example, if you have children with asthma, so if all three of your kids have asthma, and they're sharing the inhaler may be traveling all through the house or in the kids' rooms. So what you want to do is you want to make sure you have a central location for the inhaler, and everyone communicates that, yes, I used it, I had to use it, and they put it back in that central location. Okay, so communication is key in regards to location. So it could be in a drawer, it could be in the bathroom, whatever. We want to make sure that all the family members are aware where the inhaler is in case of an emergency and people are not fumbling around looking for the inhaler. All right, so also, we want to communicate. When it comes to communication, you also want to think about individual needs. So let's say, once again, back to the example where you have 3 kids with asthma. You may have one kid that needs the inhaler more than the others. So you want to communicate where this thing is. It might be with a specific child and that they are keeping track of that. And you also, when it comes to communication, you want to make sure that you're communicating the dosage. Okay, so making sure that everybody is keeping track of how many doses they took, right? So most inhalers have a counter. So have a counter on the inhaler itself, so you can tell. But you want to make sure that you guys are communicating to each other, like, hey, listen, someone's keeping track when there needs to be a refill, especially because, once again, everybody is sharing. So we really want to make sure we're keeping track of that. Okay, so tip number 3. We want to make sure there is no cross-contamination if someone is sick, or if someone has, once again, when it comes to individual needs, if someone has a cold or a flu virus, something like that, if you guys are sharing the inhaler, you don't want to get everybody else sick. So you have to consider infection control strategies. So what we would suggest is consider swabbing the mouthpiece with an alcohol prep pad. So before you swabbing out the mouthpiece with an alcohol prep pad. Okay, so, and just making sure everyone is washing their hands before and after use of the inhaler. All right, guys? We want to make sure that we're doing this safely. So if this is something that your family does or have to do, because once again, we do understand that the price of medication is going up. So we do have compassion for those and empathy for those that have this as a barrier. So we get it. You know, folks have to take out a loan pretty much to buy medication, and this is just a sad and scary time. And so we do understand these practices, but once again, we want to make sure that everyone is being safe. All right, guys. So remember that we want everyone to have their own inhaler, but if you can't, it is best to follow these tips. All right, guys. So that's all I have for you today. Okay, so that's all I have for you guys today. Know that you can also check with your pharmacy to see if there's any medication assistance program. You can ask for a care coordinator to see if there's any help in your local region when it comes to medication. So, you know, we want folks to have access to whatever resources that can help with these issues. All right, guys. So yes, thank you so much for being here with me today. I just want you to know that we have so much to come this year. It's very excited for 2024. More guest speakers, more topics, more information to share. And we just have a few new projects. So look out. I just want you guys to know, for those of you who are asthma educators and who want to, you know, work with asthma patients or anything, we have worksheets now available. Yes, look at these. I don't know if you can see them, but they're colorful. And I have them on Etsy as a bundle. Okay, and I will put that in the description for anybody that needs it. All right, guys. So yes, once again, Happy New Year. And remember to invest in yourself and to only compete with yesterday's version of you. I'll see you next week. Bye.